We move on to the third big talking point. Ahead of the festival season, actually festival season is pretty much here. And the festivities have begun in many parts of the country. And so as that happens, the central government again, and they've been doing this for several days now, again has struck a cautionary note. The government has warned that there may be a resurgence of COVID cases in October and November if citizens don't take precaution right now. But look at what is happening. On your screens are visuals from two city airports that show you the extent of crowding. Mumbai airport was chaotic this morning. And the visuals from yesterday and today, we are told the visuals that you're seeing on your screens are because there was chaos, there were delays, almost all flights got delays. Some of the checkpoint systems were allegedly not functional, adding to the stress. The airport authorities even responded because it became such a big issue and such a big story that they responded saying because of heavy festival crowd and because of high security alert, things did get difficult, but we tried our best to open as many counters, checkpoints, bring in additional security, additional airport staff to enable things to function as smoothly as possible. We can see what really happened. This is just an indication. I'm using these visuals as an indication to tell you how people are getting into the festival mode and how this must come with a word of caution. Are we moving towards normalcy? Some would say we are pretty much already living that normal life. Going out to markets, roaming around in crowds, sitting in restaurants, sending our children to school, getting back to offices in full-fledged strength, traveling in public transport, making holiday plans, having home gatherings, large gatherings, visiting relatives, shopping. What is it that we are not doing now? But don't forget, the pandemic still exists, the COVID virus still exists. 71% of the Indians are partially jabbed, but only 27% have actually been fully vaccinated. And so crowds must still be avoided as much as possible. Festival celebrations must still be limited as much as possible. We are still far away from seeing a larger impact with double vaccination. The government is cautioning. The experts would say the same. I am not one of those who would say lock yourselves up in your home 24/7. I don't think it's practical. I don't think it's possible. And any of us are in the mood to do that anymore after 18 months. But I am one of those who will bring about a word of caution such that we don't see a repeat of what happened last summer or late last year. There is also a difference between last festival season a year ago and now. The difference being that we know a little bit more about this disease, that many of us have been vaccinated, many of us have already contracted COVID, beaten it and emerged out of it, so we have the immunity. But to what extent does that mean that we can lower our guard? We will ask our experts that question. I say good evening to Dr. Rajiv Dasgupta, Chairperson for Center for Social Medicine and Community Health at JNU, member of the National Task Force. Dr. Rahul Pandit, Director for Critical Care at Fortis Hospital in Mumbai, member of the COVID Task Force in Maharashtra. Dr. Surajit Chatterjee, Senior Consultant for Internal Medicine at Indraprasth Apollo Hospital. Professor Gautam Memon, Professor in the Department of Physics and Biology at Ashoka University, also joining me this evening. Good to have you, all of you. After a while, I must say, since COVID essentially seems to have fallen off the radar for most people, I must admit, even for us to an extent. But festival time is here, and some of those visuals are scary. Dr. Rajiv Dasgupta, what should be our strategy, and just how different is this festival season versus last?
As we know, on the positive side, the infections are low at present. The risks are in general low. But then, as you said very rightly, which are the government figures? that 71% are partially have got a single dose and 27% two doses, which means that India has the largest population of partially immunized adults. And that in itself is potentially a reason for concern. Also, that even this 71% is not necessarily uniformly distributed. So there would be patches of relatively low coverage interspersed with areas of good coverage, which, as we know from experience, gives rise or at least has the potential to cause what are known as hyperlocal outbreaks. What should we do? I don't really want to preach. The courts, the governments have all come out with advisories. I'll only repeat what I said earlier also, drawing upon, or rather translating from a Bangla slogan in Calcutta, one of the Calcutta pujas, that this time it should be worship and not festivities. That's what should be the bottom line.
Worship and not festivity, says Dr. Rajiv Dasgupta. Would you want to say it in Bengali, though? Maybe bring about that flavor.
Okay. I think it says something like this. Ebochor shudu pujo utsav noy. So it's just puja and not the utsav or festivities.
Thank you for that, Dr. Rajiv Dasgupta. Let me take it across to Dr. Rahul Pandit. And Dr. Pandit, few of the regions that have always seen a relatively high case load, Kerala, Maharashtra, Mumbai specifically, Karnataka, Delhi, would these still be the regions to watch out for? Will it be some of the other parts where we haven't seen so many cases in the past, but for those very reasons, they're probably more vulnerable now than earlier?
Absolutely right, Tanvi. I think Mumbai, Kerala, Maharashtra are the regions we need to keep a very close eye on. We also know that the district of Ahmednagar actually imposed a lockdown on a few places around for around 10 days, couple of days ago. I think this kind of dynamic monitoring of the situation is extremely important. We will have to ring fence places where the clusters have come positive, because we know that the vaccination is not uniform, as Dr. Dasgupta just said. We have interspersed places where the vaccination coverage maybe or penetration may have been extremely basic right now. Even people may not have received their first dose. And those are the places where we can have clusters come up, and we probably need to ring fence those as quickly as possible. Of course, I can't overemphasize on COVID appropriate behavior. Of all of us keep on saying that, but the crowds which you were just showing on the television before the show started and the background of this whole program does make me worried that people should be cautioned a little bit that COVID is very much there. Even today in Mumbai, there are around 500 cases coming. It's not like the test positivity rate maybe 1.3. It's not like the COVID had completely gone away. So I think people need to be cautioned.
Okay, people need to be cautioned. Dr. Surajit Chatterjee, one question that I often get asked, and I'm sure you do more than us, is when is the next wave going to come? They said it's going to be in October. When will the next wave hit us? Will it be in December? Is there a clear answer to this?
Unfortunately, there's no clear answer to this. But yes, with the festival time coming in, I would expect that if there is a wave, it would happen in November, December. But yes, it's a very difficult question that you have asked. We don't have a definite answer to this, but as I said, because of the festivities that are going to be there, I don't know how people would have a proper behavior. If they have a proper behavior and people can restrain themselves from all these festivities, then maybe the cases can be controlled, because the vaccination drive at this moment is at a good rate and at a good pace. But we have to restrain ourselves. If we can restrain ourselves, maybe we can avoid the third wave in the next few months to come.
So what would be that point where we can tell people that, okay, after this, maybe you can start resorting to these kind of activities? And I say this because for many of, for most people, the pandemic began as a 15-day challenge, and then it became a matter of 1 month, and then a matter of couple of months. And then we were told, wait till the vaccine comes. And then we were told, well, you have to be double vaccinated. And then it was about, well, a large percentage of people have to be double vaccinated. Till then, you can't let your guard down. What's the next thing that we should watch out for? Dr. Surajit Chatterjee, to you before I take it to Professor Menon.
See, unfortunately, all these viruses do they do mutate, and when there are newer strains, they can always infect you. But the good thing is that what the vaccine does is it prevents you from from a serious infection or hospitalization. So what I expect that once the herd immunity is reached, which is at least two-thirds of the people are fully vaccinated, I would think that the cases of COVID would go down, and it might just become like what is swine flu today, or because it might just become an endemic disease where a few sporadic cases would obviously go on happening in the city and in the country. And that is the time when we will be, maybe we can put our guards down, but only time will tell us as to how the mutant strains are behaving, how in the long term our vaccines are behaving. As of today, we have seen that vaccine is definitely protecting, and the seriousness of the infection and the hospitalizations have definitely reduced in people who have received vaccination.
Professor Menon, would you want to weigh in on this aspect as well?
Yeah, I just want to go back to one statement that you made about what's different between last year and this year at the same time. And what's different is the new variant, the Delta variant, which was not there last year. That's much more transmissible. And that really is the reason why we had such a strong second wave in the country. That's also the reason that there's a plus and a minus to that. The plus is that already a substantial fraction of Indians have already been infected with the Delta variant, which means they're less likely to be infected again, unless it's really rise out of control. The combination of the fact that there's been a fairly recent infection of much of the population, plus a pretty strong vaccination, at least of the first dose, not really of the second dose yet, these I think will remain protective. All of that said, the sort of crowds that we are seeing at the airport are obviously not good. Anything that will tend to increase the circulation of the virus in people, even for people who've been vaccinated earlier or who've got it earlier, is not good. So please continue to wear masks. I think that is very important. Try to reduce crowds, again, very important. Maintain care around these. And I suspect that we'll be able to get through this festival season okay.
But picking up from what you said, and Dr. Rajiv Das Gupta, those are the variants that continue to be a cause for us. Are there some new ones that we need to also watch out for?
I certainly agree with what Professor Menon said, and India has experienced the tsunami of the Delta wave. So, as I said earlier, on the positive side, the seroprevalence is actually quite high. The effort has been to actually have seroprevalence figures or serosurveys at the district level, but that's easier said than done. It's resource intensive. It requires trained human resources and so on. So actually, we do not have district level serosurveys to enable us to have more granular strategies. But even then, as you showed, the crowds, if this is a forerunner of what the festive season would be, and this would be a month-long festive season across states, it's certainly not. It may not be as comfortable as things are now.
Okay, let's talk a little bit more about that because couple of months ago, the seroprevalence surveys that was done at a national level showed that there were several states where seroprevalence was above 60%, some states even above 75%. But Professor Menon, would you agree that until we know a more micro level, maybe a district level data, we shouldn't take it too seriously as far as state policies are concerned?
Well, it's certainly true that you need more micro level data, and slowly that data is emerging from some of these states. But already by the time you're talking about the serosurveys, which is showing you 70 to 80% across much of the northern states, so that's the states of UP, Bihar, Rajasthan, MP, etc. And this, remember that the serosurvey was conducted over June and July, just after the peak in May, when there was still a substantial number of cases. So that number, the actual number of those infected, is probably a further 5 or 10% above. I suspect this is the reason why cases are really declining across much of the north. It's really the south of India that is seeing a sort of sustained yet not too high level of cases and a reasonable test positivity. I think the north I would worry a little less about. I would worry much more about states which reported a low seropositivity in the ICMR fourth serosurvey, as well as those which do not have high levels of vaccination. These, I think, should be special points of interest for us.
So let me now turn it around a little bit and ask the same thing in a different way. And to you, that Dr. Rahul Pandit, if a large percentage of people have, as the sero prevalence surveys show, have already got the antibodies via vaccination or infection, then should we be this concerned? Or because we don't even know how long these antibodies may last in our system, we can't afford to let our guard down?
So there are two things here. The first thing is we really don't know the concept of herd immunity with COVID-19. The goalpost has changed consistently. We started with 60 to 70%, 80%. Now some of the studies are saying that even 90% may not be good enough. That's one. Secondly, the antibodies may go down, the levels may go down, but that does not reflect the complete immune system, especially for people who have had infection with COVID-19 before. Their T cell memory may be actually pretty good, and we may not have a complete idea of their immune system just by looking at the antibody level. So I believe that we are probably not very clear. I think we are on a safer side and a better side with the antibodies and the sero surveys being present there. But we can't be very complacent about the fact that we still have COVID cases which are coming positive. Even the breakthrough infections, though they may be mild, they're still happening. And then those are the patients which have a potential to spread it into the population, which probably has got low antibodies or has no seroprevalence at the moment. So that's where the concern is. Another concern is the immune escape. We are talking about a new variant coming in. There is also talk about, at least in the scientific theory, that you may be actually seeing something which would worry us is the immune escape happening in one of the variants. Luckily, at the moment, we don't see any of that right now, and I hope it remains that way. And it probably just remains a theoretical possibility, not one which actually happens.
Okay, let me ask now one question that runs in everybody's mind, purely because in several other parts of the world it has begun to happen, and that's the concept of booster shots. Dr. Rajiv Dasgupta, what is your view on whether we need it or don't need it, or we're not there yet? Let's first get at least one round to everybody in this country.
That really is the WHO position at this point, that we are not there yet, globally speaking. And since this is a pandemic, one will have to think in population terms, including in national and global terms. Even at the national level, we still have a whole lot of ground to cover. And therefore, while boosters are in principle would be necessary for a vaccine of this kind, just as any annual influenza vaccine is, this given the range of crisis that COVID can cause and that we have experienced, this is certainly not the right moment to consider it.
But okay, so one aspect, of course, is even WHO says about first getting the first round out to as many people as we can. But scientifically speaking, will there be a necessity for booster shots, additional shots? There are so many people currently in our country, obviously those who can afford it, but are being advised by their doctors to travel to another nation, go to the Middle East, get a shot of another brand of vaccine and come back just to protect themselves more.
Well, like medical tourism, vaccine tourism will emerge. That's the nature of markets and behaviors and demands. But that's not what the population level strategy is for the governments. At the same time, it needs to be recognized, and in fact, the medical fraternity has been asking for it, that, and in fact, as Dr. Rahul Pandit said very rightly, that immunity will wane off, that those in the front lines, particularly in intensive care settings and so on, will need boosters. But that's a special category, just like, say, the immunocompromised are. But those are very specific categories, and certainly not for us to consider it population-wide.
Professor Menon, would you like to weigh in on this as well? And of course, one aspect is what the government strategy needs to be, but the other is also what people are discussing and invariably will figure out ways to then do, should they resort to that.
So Professor Dasgupta is completely right that there is no real indication that you need a booster shot at this time for someone who's had a recent vaccine. It's important to prioritize people who may need it, which is the elderly and the immunocompromised. That's a fairly small segment of the population for us right now. We should concentrate as a country on getting as many jabs, first doses, and then second doses, as many as possible. The moment you reduce the burden of cases in the country, the chances of your intersecting someone who carries the virus is substantially reduced. So from a public health point of view and from an individual point of view, it makes sense to get the vaccine out. By protecting everybody, you're protecting every individual as well. By extending it to the population, you're also protecting the individuals.
All right, on that note, I'm going to thank all of the panelists for joining us. Thank you so much for sharing your expertise and insights. And one common thing that all four experts have pointed out: yes, we are in a better state today in terms of number of people who may have antibodies, in terms of people who have gotten vaccinated, one shot or two shot. The fact that the cases haven't, shot through the roof aren't significantly high, but the cases are on the rise, and at no point is crowding like this acceptable. It is not advisable or acceptable at all what's happening across some of the markets, some of the airports and tourist zones is very, very dangerous. We will be then consciously calling for another wave. Somewhere we need to ourselves draw the line such that we don't have to lock ourselves up for another few months, such that the cases remain under a certain level and we don't have to go through the nightmare that we went through last summer. It's in our hands. Thank you so much for joining us on this conversation.